sorry about that.
You've about 7 minutes left, if that's okay.
A bit of coughing there. It doesn't look good in these COVID eras, but I hope I've protected you.
That's why we all put our masks on.
I know. I just want to ask Dr. Boylan, do you know of any example of something similar to this anywhere else in the world where such a complex, convoluted, labyrinthine deal has been done to co-locate a hospital?
I don't. And I also don't know of any hospital in the entire world which is owned by a successor organisation to a Catholic religious congregation.
Right.
It's unique, and to think that Dublin 4 is going to set the pattern for the world.
Right, okay.
Bit,
there's a more serious question, though, that I just need clarification on. Stephen Dodd did a briefing for Uplift, and you've probably seen it, but in part of it he talks about, and what I'm getting at here is I'm beginning to think, obviously the religious history, the mistrust and all of that we've all spoke about is a big part of it, but I'm beginning to think that this is more about mammon than it is about God, that it's about money and it's about corporate interests. And when Stephen Dodd says in his briefing to us that there's a clause in the lease, clause 7, that allows for the permitted use, and he says the definition permitted use is crucial. Clause 1 defines permitted use as the National Maternity Hospital being used as a public hospital primarily for the provision of all clinically appropriate and legally permissible healthcare services. It's there again in the title of it, and then he goes on to say it goes further on to say that provided, part of the clause in the lease is that provided always that the permitted use does not preclude the provision of any private healthcare services relating to the above which are permitted or envisaged. So is this a clause that doubles down on the state leasing the land on the question of private care in that hospital, even though it's built with public money? If you follow, or am I being too convoluted?
Yeah, there is,
and the reason I was kind of interested in it was because of that statement yesterday from Deirdre Madden and Sarah McLaughlin, and they're really concerned about the independent review that was established by Simon Harris in 2018, and the outcome of that review that Dr. Catherine Day was involved in, which really recommended in very strong terms that it's far better for the state to own the land when there's co-location, and they recommended very much. And obviously that recommendation, that review that was ordered by the government is just wiped away, and everything else has gone ahead with. So it just kind of triggered with me that this is more about the corporate interests rather than anything else, and they're doubling down everywhere on it. Just your comments.
But there is space in the new design for private consulting rooms, and every room will be a single room. So I'm not sure what the allocation will be of private versus public beds. Rooms. I'm not aware of what the
It's not in the design yet or in the maps.
Well, if they're all single rooms, I don't know whether one area will be put aside for fee-paying patients, private patients insured, or whether they'll be mixed in. I just don't know. So, yeah, but certainly that independent review, and Deirdre Madden and Jane Grimson were also very much involved in the review that was chaired by Catherine Day. And they were absolutely very clear with their recommendation 6.3 that the land should be owned by the state. And indeed the Taoiseach and the Taoiseach have said in the Dáil that the hospital would be state owned on state land. So that's actually not happening. And that, as you say, that is accepted by government, as I understand the recommendations of that report.
Yeah. Okay, thanks very much. Thanks, Chair.